pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm going to go with the invocation also. Father God, thank you for this day. Thank you for drawing us here. Help us, Lord, to have understanding hearts, clear minds, and to do what you would have us do. Pray this in Jesus' name. Amen.
Amen.
Before we move on from there, I'm going to make a statement. I've had a lot of calls and emails and input regarding opening with prayer. And let me say this. No one is required or forced to pray. However, there are a number of us as commissioners who want to start with prayer. And as your elected officials, we have not forfeited our right to practice our religion. If you don't want to pray with us, by all means, don't. If you do want to pray with us, by all means, do. That's all I'm going to say. Roll call, please, Mel.
Commissioner Turnbull,
Here.
Commissioner Aaron's,
Here.
Commissioner Rubing,
Present.
Commissioner Mason,
Here.
Commissioner Mapes,
Here.
Commissioner Levanway, here, Commissioner Hankins,
Here.
Commissioner Chamberlain.
Present.
All right, thank you. Would anyone like to add or remove any agenda items? Hearing none, we'll move on to the review and approval of the meeting minutes from October 3rd, 2023. Would anyone like to make a motion?
I'll make a motion to approve the minutes. Second.
Been moved and seconded. Any further discussion? Hearing none, can we have a roll call, please?
Commissioner Mason.
Aye.
Commissioner Rubing,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Hankins,
I wasn't here, so I'm not going to vote.
Commissioner Aaron's,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Chamberlain,
Yes.
motion passed.
All right, ladies and gentlemen, that moves us to public comment. If you would like to address the Board of Health, we'd ask that you step to the podium, state your name and where you live. You'll have 3 minutes to address the board. And here's my list of folks who would like to. Good morning. Thanks. Only 2. Wait a minute. That can't be right.
It's an off year.
People are out for deer hunting already, Jonathan. Ryan Donahoe from Emmett County.
Good morning. I am Reverend Ryan Donahoe of the First Presbyterian Church of Petoskey. And as a Christian, I recognize that you have a right to your beliefs, but also your job is to represent all the people of your counties and all the people in your districts, and not all of them are Christian. And also, so you know, there's a lawsuit currently in Ottawa County regarding who is allowed to give the invocation at public meetings down there. But in respect of those people that were here before many of us were on this land, let us pray a prayer from the First Nations people. O our Father, the sky, hear us and make us strong. O our Mother, the earth, hear us and give us support. O Spirit of the East, send us your wisdom. O Spirit of the South, may we tread your path of life. O Spirit of the West, may we always be ready for the long journey. O Spirit of the North, purify us with your cleansing winds. Amen. And I ask you again to truly represent the people of your district and not impose your beliefs upon them. Thank you.
John Swartout.
John Swartout, Emmett County.
Mr. Chairman, I would like to encourage you to continue to open the meetings with an invocation. To the extent that prayer makes some people uncomfortable, that's good. They should be uncomfortable. I also encourage the public to continue to use public comment opportunity to offer prayers of a different sort if that's what they like to do. The Constitutional Convention ran from May 25th to September 17th, 1787. It wasn't billed as a constitutional convention. It was supposed to be a venue to revise the Articles of Confederation, which were proving inadequate to the needs of the young country, but it morphed into a constitutional convention. And for the first several weeks, prayer wasn't part of the proceedings, but for the last nearly 2 months, it was. There was a lot of rancor in those first few weeks. And the convention was nearly at an impasse. And thanks to the contribution of one venerable delegate to the convention, prayer was added. And during public comment at the end of this meeting, I will read to you the motion made by Benjamin Franklin that set that ball in motion. It takes me 3 minutes to read it, so I'm not going to start during this public comment, but I'll be back to read it at the end.
Would anyone else like to address the Board of Health? All right, hearing none, we will close public comment and open staff reports. Mr. Thorell.
Okay, good morning.
Morning.
Okay, so leading the first item on my staff report is just to give an update on Children's Special Health Care Services. Many of you may not be aware of that program, but it's been around for quite a while. And basically the age limit is being expanded from 21 to 26. So where kids that were had chronic diseases that were in this would age out at 21. Now it is actually 26, which kind of aligns with private insurance and some of the other insurances that are out there, even Medicaid insurance. So this program is administered by MDHHS, the Michigan Department of Health and Human Services, but the Health Department of Northwest Michigan staff provides the local coordination of this program for enrolled clients. So it's part of Children's Special Health Care is part of Title V of the Social Security Act. And through this funding, we get base funding from MDHHS to the health departments. And due to this anticipated increase in caseload from the age expansion, we are getting a bump of about 22%. So to go from 82,640 to about 100,821 is what we're being told. Also, many of the services that are provided by the health department for these clients are billable to the Medicaid and billable to insurance. So that helps fund the program as well. So really what we do primarily is we're helping children and young adults with their chronic health problems. And this is through coverage and referral, like connecting them with MDHHS to get signed up, family-centered services, community-based services, cultural competent services, and coordinated services. And really this is to kind of just boil that down is we're helping families that have with kids that have these conditions, helping them navigate the system, helping them get to where they need to go. Lots of times in our area, because we're pretty rural, we don't have the specialty care that some of the big cities do, like Grand Rapids. A lot of kids will go down to DeVos, or maybe they go down to Detroit to Henry Ford or U of M. And so that's, we help them, these families navigate those challenges to, it may be figuring out transportation, it may be figuring out, where are they going to stay when they go down there, and all of those type of things, as well as do a care plan for the child as they are navigating through this disease and trying to figure things out. And then it may also be things like durable medical equipment. If they need oxygen, if they need a wheelchair, if they need, they may need a bigger door to get into their house. So, finding a contractor to do that. And sometimes Children's Special Healthcare will pay for those type of things, modifications, if you will, to a home to account for those conditions. So how do you become eligible for Children's Special Healthcare? Basically, there's about 2,700 physical conditions that are covered, but it does not cover developmental, behavioral, intellectual conditions. Examples are like cystic fibrosis, lymphoma, diabetes, leukemia, but like I said, there's many, many more. And then as stated above with age, this has been expanded to age 26. So basically you're covered through your 25th year. And then there are a couple of conditions or a few conditions that actually go beyond that. And those are cystic fibrosis, hemophilia, and then also sickle cell disease is part of that. So also clients need to be Michigan residents. Eligibility is not based on income. There is an annual fee to join the program, but it's on a sliding fee schedule. So if you're Medicaid, my child, or a court appointed guardian, that fee is waived. And then the sliding fee schedule is basically on, income based. So if you make more, then you would pay more, make less, pay less. So, and I'll just give you a couple of examples, where this age expansion kicks in is an enrollee who just turned 21 that may need infusions that cost $5,000 a quarter. And the family now, would need to pay out of pocket. They will now be covered after January 1st if they re-enroll in Children's Special Healthcare. Another one would be those that have diabetes, they can continue their coverage to help pay for insulin, blood testing supplies, medical appointments to control their disease. And then if they are covered under their parents' insurance, Children's Special Healthcare will help cover some of those copays and things like that. So in essence, this program helps clients and families manage difficult chronic diseases, which would otherwise even be more physically, emotionally, and financially challenging than they already are. It's a good program. And I've seen it firsthand, and, just being able to, help folks that have, if you haven't seen it or don't know anybody that's been through something like this, but it can be, life-changing, and just every little bit of help, just is very much appreciated, and we see that. So moving on to some highlights from October, the Michigan Association of Local Environmental Health Administrators met with Representative Skaggs, and this is regarding the statewide code bills. So they met to discuss the bills because currently in the House and Senate, they're not going anywhere. They are going to be brought back. We're in a short session, I think many of you know. So I believe this week they're wrapping up the legislative session, and then they are going to adjourn until January. So we expect that these bills are going to be brought back up in January, February. But because Representative Skaggs, who's out of Grand Rapids, received so much opposition to these bills, they, finally, which we're happy about, reaching out to Michigan Association of Local Public Health and MLEHA to, basically, hey, what can we do to make these better, right?
Why not talk to the folks who are going to be affected?
Right. Yeah, that are going to
What a great
implement.
thought.
Yeah, going to implement things. So I was invited to be on this stakeholders group, which I think is good to represent Northern Michigan. I think I have a pretty good handle of, the concerns that we have. And this is going to be facilitated by SIMCOG, which is the Southeast Michigan Council of Governments. And it's going to begin on November 16th. Obviously, there's not too many deer hunters in this group since they picked that date, but, I'm taking one for the team and I'm going to go down to Lansing. So So that, and I'll keep the board apprised of what's going on with that, but I
Dan
think
Jarris
it's,
has got deer that you can go out and shoot on the 17th.
okay,
I
I'll hold them
promise
to
you.
that, so.
Okay.
So yeah, that's good. And like I said, I'll keep you apprised of what's going on. In early October, the Health Department of Northwest Michigan held a one-day vaccination clinic on Beaver Island, which we do pretty much every year. And it was attended by 101 clients, or about 20% of the island's residents. Will Queekle, I think I'm saying his name right. Swikel, I'm sorry. Thank you. He is the superintendent of Beaver Island Community Schools, and he always works with us to coordinate this event. It's an important community event for the island. It's held at the school gymnasium. There were about 184 immunizations given that day, and it's anywhere from seasonal flu, those that wanted the COVID-19 immunization, and then getting kids caught up with childhood vaccines. So this is really a highly successful clinic, and one of the multiple clinics that we offered during the fall as we venture out of our offices to make things easy for the public during this time of year. We had community clinics, which we had 11 in total. Many of those were at the schools, and anybody can come. And like I said, people can bring their, the adults can get the shots that they need, and then they can bring their kids. We do senior clinics, we had 17 in total there. And then also for businesses that would like us to come, which tends to, I don't know if this has grown every year, but we do have a number of businesses that they have a large number of staff, and it's just easy for them. We come on site, their employees get what they need or want, and then we're they're done. And I think it's a good service that those employers offer their employees. Moving on to item 3, the director of regional planning, Jane Summacher, has decided to step back from her role as director of regional planning and work for HDW on a part-time basis. And the director, what we're doing with that director of regional planning position, we're just gonna it will remain vacant at this time, to make, with fiscal responsibility in mind. We're taking a look at our organizational charts right now. We're working on our plan of organization. We have state accreditation coming up in March. So we're looking at a lot of these things, and we're just kind of evaluating, our needs in that area. So right now, any regional planning responsibilities are being absorbed by administration, whether it's Holly Campbell, sitting next to me here, deputy health officer, taking on the lead, or myself taking on responsibilities. We have the behavioral health initiative, which was part of regional planning, and that is taking place down in Traverse City, working on that crisis center, the mental health crisis center. So that project is still going, but in its I think another year to go on that. So moving down the line, the Charlevoix Chamber of Commerce had a state of the community event on November 3rd, which was last Friday. I was asked to speak at the event to give an update about the health department, and it was at Castle Farms. It was really a great event. There was a number of individuals there, anywhere from an update on what's going on with fiber in northern Michigan and our area in Charlevoix, to the trail system. Trails Council was there, DT Energy was there, and Scott, who is the superintendent of SHRM, was there, Intermediate School District, and just, a lot of good information. I was happy to be part of that event. Had 10 minutes to basically sum up everything the health department does, which is a very challenging task, but I did my best. But yeah, happy to do that. And nice facility there. I was kind of joking around because I'm like, okay, last time I was here was 1988. I was out there. It was Def Leppard, and kind of dating myself, but I was a teenager, so. But that's all I have for my report. Do you have any questions?
Great. Thanks, Dan. Anybody have questions for Dan? Go ahead, yours.
Yeah, On the childhood, your number one.
Yeah,
Just curious, how many kids do we have in northern Michigan that we're
Yep.
that we're helping right now?
yeah. So, actually, thanks for asking that because I have that written down here. I was going to tell you that. We have 420 clients right now throughout our 4 district. We have 74 in Antrim, 88 in Charlevoix, 140 in Emmett, and 118 in Otsego.
And what are those numbers going to do with the expansion?
Well,
Or is that after the expansion?
no, this is before the expansion. So the expansion starts January 1st. So we anticipate, or Children's Special Healthcare, MDHHS anticipates that it'll increase about 22%. And that's why they bumped up our base funding by that amount. So that is what the anticipated increase will be.
Okay, so most of these kids are covered by Medicare or Medicaid. I get the two mixed up. But so what, I guess my question is, you kind of answered, like, they may need a bigger door for a wheelchair but I guess my question is, what does the $100,000 for? Because I mean, there's kids that are signed up on Medicare, but they're not part of this children's health.
Mhm.
So I'm just curious what exactly that $100,000, is it primarily geared toward things that Medicare doesn't cover, or?
Yeah, exactly. So what it does is, we have public health nurses that work in this program, and they actually do a care plan with the family, and they'll go out and do home visits, look at their home where they are, determine any needs that they have there, determine, if there's any problems with where they're living. Like I said, increasing the size of the door, maybe they need a ramp to get into the house, or any number of things. And then also, helping coordinate the durable medical equipment, like I said, or figuring out transportation, lodging for those appointments that are way outside of our area. All those type of things come to mind as far as that goes. And I don't know if I'm missing anything. Melissa Hahn oversees that program. If she wants to add anything.
That Dan did a great job of explaining. But I do just want to clarify that not all of those kids are on Medicaid. Lots of those kids are covered through their parents' insurance, just like any other diagnoses would be. But those have high copays often, and that's where this comes in. If if you're paying a copay every time, but then you're also driving to Grand Rapids, and then there's things that aren't covered under that insurance, this kind of comes in as that safety net for those kids that have those multiple diagnoses. This also just covers related to that diagnosis. So when they go for their well child, that's their regular insurance, but this is all those extra things that come up when there's those diagnoses. One of the most important things is having a nurse in the area that can come out to the house or can answer the phone quickly, because I don't know if anyone's tried to call a major medical center, but those parents, they see their specialist and then they try to connect later, and it's a struggle. So having a nurse that is going to answer the phone, knows the system, can then contact, is really important for our families, especially when they're so far away from the care.
And then on number one, on the septic, what other, I'm really glad that you're on, but who else is on? Do you know?
Yeah.
How
So
many people and who?
I don't know. I'm going to find out a lot more. I've been trying to get that information through email, but I haven't got a response yet. I'll definitely find out by the time I go to that first meeting. But my understanding is that there's going to be individuals from the real estate lobby there, and then also some environmental groups, and then we have a few from local public health. And then you know, I'm not certain about the others, but I think the bill sponsor was leaning heavily, not including us, but talking to those others. And he's bringing those people to the table. And I think we're gonna find that out. You know, we have some core principles that we set up a few years ago, the first time the statewide code bill came up back in like 2018. It wasn't the first time, but it was one that had the most momentum. And one of the things, you know, is, you know, we're not opposed to, and I said this before in at the Board of Health, is we're not opposed to minimum standards statewide, because there's not minimum standards. Every health department has a different standard, and there's not a minimum bar. And there's some that are in different parts of the state where they're very weak sanitary codes. We have a very strong sanitary code in Northern Michigan. We have a lot of sand. Our forefathers, you know, realized that protecting natural resources and the environment was a good idea back then. So, you know, we have good codes in place. So that is not going to be a big factor for us to have a minimum standard, because it's going to be less than what we have right now. The hard part is the inspection part, right? Where they wanted to do every 5 years. And I think, you know, pretty much most local governments lined up against that. I don't know of any that said, yeah, that sounds great, let's do it. I think something that is more doable and something that we have in our core principles is more of a trigger type inspection. I think, you know, there is going to be a bill with an inspection component. It's just what makes sense, what can we live with? So a time of transfer seems much more palatable. I mean, at that time, you have a buyer and a seller, there's money on the table, you know, they're already doing inspections of the house. Lots of times they're doing inspections of the septic and well anyways. And then things get, you know, determined, addressed at that point. If deficiencies are found, there's money on the table, you can, you know, negotiate and come to an agreement. Is much more palatable than a blanket, you know, across the board for everybody. You know, you have to do this inspection. There is a big criticism with that. The time of transfer is that you're not picking up the waterfront homes that are in trusts and things like that, because they never transfer. You know, one of the things that Torch Lake Township did is they said anybody within 500 feet of a body of water had to have an evaluation, right? And that could be maybe a compromise. I don't know exactly, you know, how this is going to play out, but that's some of the things that we're, you know, bringing to the table.
Yeah, I'm really glad that you mentioned it, because as you're very well aware, soil type is huge.
Right.
And this is my first year on the Sanitary Board of Appeals. And, you know, when the health department came out and they drilled various holes to check to see how far the water was and how well it drained, if rainwater doesn't drain, then wastewater isn't going to drain well either. So I thought it was very fair, and I was very impressed. So
Thank you.
All right. Anybody else have any questions for Dan or any of the other directors? Hearing none, we will move on.
Scott, I do have something for on the lead for Meyerson. Are you asking about all the other reports, or?
Yes.
Okay. On your I think you brought us a lead report last year. Maybe you do it every year. I'm not sure. I know we talked about it, but I guess it would be helpful for me. You've got some imported candies, some imported spices, some traditional medicines. If we could list what some of those things are to watch for, because that's really vague. You know what I'm saying?
Right. You know, I'll be honest. I don't know if I will try and find a list for you. I don't know that there's going to be a concrete list of that. I think when you look at imported spices and things, or things that people may bring back with them when they do travel, it would be hard. You know, it would be hard to say that, without testing each one individually, if it had it or not. There's certainly, we have regulations about what can go and what can't go in things here, but when things come from other countries, sometimes you just don't always know what you're getting. So I will try and get that for you. I can do a little digging, but I don't know. I don't think I've ever seen a concrete list. I've just seen it listed just like that, where they'll talk about reports where they've had people children lead poisoning from spices brought back, curry spices or turmeric or spices like that brought back from India that I don't know that it was on purpose. It may have been the machinery that was used that had lead in it. I've seen reports of, ceramic plates and things like that, or dishware that has lead in it that came from other countries. But it's not going to be like, oh, this brand that they bought at Target, it was something that they brought in that came with them or came from other places that happen to have lead contamination that could then, be ingested by the child.
Right. And then on your second page, you've got your number of children tested, and under the EBL, you have suppressed with an asterisk.
Yeah.
Just curious what that means.
Yeah, I was waiting for you. I assumed you were going to ask me about that. So the way the state, you go to the state website, anyone can go there on their My Tracking website and look that up. And so EBL is elevated blood lead level. And I was looking at venous blood levels of 3.5 or higher. And they won't report, they'll tell you if it's 0 and they'll tell you if it's 6 or more. And if it's 1 to 5, they just call it suppressed because they have concerns about anonymity and privacy and things like that. I'll be honest, I don't know if I fully understand that reasoning, but that was as good as data I could get for you there without, I tried to drill down more than that. So suppressed means it was somewhere between 1 and 5.
And so do we know, I mean, we had 3 in Antrim County and we had 1 in all the others. Do we know what the kid got into or not?
Every time when we have a child who has an elevated blood lead level over 3.5, that's, a venous blood level, not capillary, it gets confirmed. We have nurses who then follow up with that family and offer supportive services, and they generally try to identify what the source is so they can reduce that source, and then also go through other ways that they can help that family mitigate, the lead exposure and reduce it moving forward. And typically it is lead-based, it's dust from lead-based paint in the house. We have had some where it's been occupational, a parent bringing it home on their clothing. And I think we had one case, I think, where the nurse found out it may have been related to a faucet in their house, so it was in the drinking water. It wasn't in the water coming in their house. It was actually getting picked up by an old piece of hardware, a faucet, and they could change that. And that helped obviously eliminated that potential exposure.
Thank you.
Dr. Myerson, I can add that in the maple industry, this has been a big thing. A lot of older equipment was used with brass. And after brass heats up, it releases lead because you need lead to create brass. So that's been something they've really been focusing on, and that could be exposed. That's why I thought when you talked about in the faucet system, if it's brass, it could be leaching lead into the water.
Right. And that, with occupational exposure, it's just really good for if the employees know that they have their work clothes on and they change before they come home. And I know I had a patient back when I was in practice where it was, a dad who loved his kid and would come home from work and hug him and cuddle him and feed him. And he was unknowingly, he had, lead dust on his coveralls from work and was exposing his child to lead, and just simply, changing before he left for work eliminated the problem. So it'd be good to know that, beforehand.
My dad's generation, he made his own lead soldiers.
Yeah.
Remember those?
Jeremy, I just wanted to mention the 4-year comparison you gave of septic permits and well permits. this is a really nice graph and it's laid out a lot better than it was last year. So thank you.
Yes, Mr. Chairman.
Mr. Mason.
Speaking to, it's an interesting thing. You're speaking to the herbs Americans, but I think a lot of that comes out of India, some of these large populated countries. It's known shale carries lead and mercury. So even locally, it's there, but it's encapsulated. However, trees will take up and absorb these minerals along with everything else. And so ash, for instance, and I use some ash in my garden, but you're supposed to use very minute amounts because ash carries a fair amount of lead in it. And so it wouldn't surprise me. You look at these countries that have for centuries been gardening and farming, that they may very well carry that into the plants that they, excuse me, that they grow in this environment.
Interesting.
We carry it in Michigan. Ellsworth has a lot of shale. It has huge deposits. Gaylord has a fair, we have about 2 or 3% shale in our gravel there. Sheboygan has 0. Grayling has probably a fraction of a percent. Kind of the middle of the state, with Gaylord being the exception, we carry a lot of it in our so.
Yeah, it's a good point that lead is a naturally occurring substance, and it's not necessary. You can be exposed to it through very natural ways as well. It's not just from a man-made issue. Mhm.
Anything further for our directors? Okay. Committee reports. Personnel and Finance Committee. Make sure your microphone's on, please.
No.
Put it to mute and back on. Click it down and back up.
Okay.
There you go.
We need to make a motion. The Finance Committee met to review the bills and employee expenses and would like to make a motion for the full board to approve the October 2023 bills in the amount of $706,361.33 and the October 2023 employee expenses of $18,880.67, in which I'll make that motion.
There's a motion. Is there a second?
Second.
Been moved and seconded. Any further discussion?
Yeah, 2/3 down. 2/3 down on page 1. Courtney Jerome Media for 5,500. I was just curious what that is.
There we go. That is for video production that we're doing to use for different social media platforms on our website, kind of updating who we are, what we do. So that's the video services that we got with that one.
And then on page 2, about the same spot, 2/3 down. Gardening coordinator, Larry Dyer. Just wondering what that was for $1,000.
Hold on, I'm finding it. I got it. I don't know off the top of my head. The gardening coordinator, I would assume that's something that has to do with either some of our landscape that we have at each of our offices. We contract that out. Because it says coordinator, I'm not sure if it's related to a program, but I can't think of a program where we would have a gardening coordinator. So I can look at it. Oh, yep. That's it. Thank you, Kathleen. We have farm to school program in Petoskey. So that would be our gardening coordinator for that program. Thank you, Kathleen.
Are you done?
I'm done.
Is it necessary to have that position? Because I had the same thing marked down the garden. What is it, a monthly? Is that a monthly?
No, so this was a grant that was written a while back that had to create gardens at the school. And the garden coordinator was a position that was responsible at the school to take care of the garden during the summer months when there was nobody there. So our staff helped to create sustainability in that school district to continue that program after the grant ends. So they give the school and interested community members the tools necessary in order to continue that work. So it's a one-time fee.
What school is it?
I would have to confirm that it was Petoskey because we have a couple different projects. There's one in Gaylord, Pelston, and Petoskey schools. I'd have to confirm which district it was for that one.
Any further questions or discussion? Hearing none, we have a motion. We have a roll call, please, Mel.
Commissioner Rubin,
Yes.
Commissioner Henkins,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Mason,
Yes.
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Mapes.
Yes.
Motion passed.
Position reclassifications.
I will move. We met this morning on this as a committee. I move to update the current IT data management analysis. Data management analysis reposition will become a senior systems administrator. In addition, the publishing specialist position be updated to a digital content specialist. All of these positions will remain as the salary grades for the health department of Northwest and salary classification schedule effective immediately.
There's a motion before us. Is there a second?
Second.
Seconded by Commissioner Aaron's. We have a motion and a second. Is there any questions or further discussion? Mr. Rubin.
I don't have any issues with it, but the effective immediately seems like it should apply to the first two sentences of the motion and not to the last one because the pay isn't changing. So there's nothing to be effective immediately about their pay. But
This,
it,
to be honest with you, I'm not sure why we're considering this. I think this is more of an in-house director's decision than it is a Board of Health consideration. Dan, you have,
Yeah, it's in our policy, personnel policy, is that if we make any substantial changes to the classification schedule, even renaming positions, that we have to bring it to the board for consideration. So,
well, I guess we need something on our agenda, right?
right.
Okay.
Mr. Chair,
Mr. Turnbull.
is there anything that changes with these positions other than, is it just kind of like rebranding, just changing their titles?
Exactly. Yeah, it's just basically updating, these are IT positions that were set up, I don't know, 6 years ago, 5-6 years ago. And IT changes radically year to year. So it's just more or less updating those positions to be more in line with today.
Okay, thank you.
Okay.
Yeah.
Any other questions or discussion? Hearing none, can we have a roll call, please?
Commissioner Henkins,
Yes.
Commissioner Levanway,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mapes,
yes.
Commissioner Turnbull,
Yes.
Commissioner Mason,
Yes.
Commissioner Rubin.
Yes.
Motion passed.
Thank you. Program and Evaluation Committee.
I have nothing new to report at this time.
Thank you. Moving on to unfinished business, we have none. Moving to new business. January 2024 meeting discussion. Dan.
Yeah, so it was just kind of looking ahead on the calendar and the first Tuesday of January is a holiday for us because we have New Year's Eve, New Year's Day off. And that occurs over the weekend. So when that happens, it gets bumped into the week. So we would have to, I guess, last year we did not have a meeting in January. So I mean, that's an option, or we change the date of the meeting. That could be an option. I just wanted to bring it up as a discussion point.
Can we move it to January 1st?
Well, January 1st we're also off that day. So yeah, that's a
Okay.
Monday, I believe.
Yeah, it
Yep.
is.
Right.
What's your pleasure, board? Do we want to suspend the meeting in January? Do we want to reschedule it? Do we want to hold it on January 2nd? The only input I got there was Commissioner Levan was saying no.
My question is, do you have a lot to report in January? Is it necessary to have a meeting?
I mean, typically in December, with all the holidays and everything, there isn't a lot typically. So I would say the answer to that is no, we should not have a lot to report. I mean,
think
we
the
do have
reason we didn't have one this past January is because of new committee assignments from different health or from different.
because we had an
county
election,
boards.
because we had an
Right.
election.
Correct.
Right. So we had new commissioners. So starting January 1st, like we had people that were not even commissioners
Appointed, yeah.
anymore that were on our board.
Right.
Yeah. So that is the reason that happened that way last year.
So
Absolutely.
will Bill Pay still be doing them around the 15th of January?
Yeah, I would say we would still do that. And then we would, if we did not have a meeting in January, then we would do the bill pay around the 15th and then just bring 2
Okay.
months worth to kind of like we did in July.
Yes.
Because we didn't have,
Okay.
for the same reason in July, because the first Tuesday was on the 4th of July, we didn't have a meeting in July.
So I'm okay with that if we just don't have a January meeting and do Bill Pay.
You wanna
Unless
make a-
there is something important, you could call a special meeting, correct?
That's true. I mean, if something came up that was like, we needed to
Something
fix-
that needed action, we could. call a
something that
special
needed
meeting.
action, right, then we would have to, assess that and call a meeting for sure.
You want to make a motion to that
Sure.
effect?
I'll make a motion that we do not have a January 2024 board meeting, but Bill Pay will still happen for January.
I'll second.
Moved and seconded. Any further discussion? Hearing none, can we have a roll call, please?
Commissioner Chamberlain,
Yes.
Commissioner Hinkins,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Mason,
Yes.
Commissioner Rubing,
Yes.
Commissioner Turnbull.
Yes.
Motion passed.
I'll miss you all in January. All right. Office closures, December 14th for annual all-staff meeting.
Yes, so on December 14th, we want to basically close the office for our annual meeting. We, similar to what we did last year, we were meeting at the boathouse, that's what it was, the boathouse in East Jordan. And all staff are going to be there. We're going to do various trainings and presentations. I believe we had the state police come in there as one of the presentations on driving in the winter, defensive driving and things like that. We're going to cover other, staff training needs during that time and try to have a little fun, have lunch, and should be fairly festive with, people wearing their Christmas stuff. And yeah.
If I remember correctly, last year we were invited also, right?
Yes, and absolutely. That's,
Okay.
Definitely the case this year too.
Put extra patrol out that day.
So do we need to make a motion to approve of that for you to have?
Basically, what we need is a motion to close the offices for that day to allow us to have an annual staff meeting. It's the one time of year you know, because we are a district health department, we have offices in several different locations. It's the one time a year that we're able to do that with all staff and get together for that one day. So, and it's typically, we only do it one time a year because of that reason.
I want to make a motion that we authorize the closure of Health Department Northwest offices on December 14th for the annual all-staff meeting.
I'll second.
Been moved and seconded. Any further discussion? Go
Just,
ahead, Jared.
just want to make sure we get that on our website so people know
Oh, yeah.
ahead of time.
Yeah, definitely.
Yep.
And one of the things that, you know, we talked about a couple weeks ago, and put that out on our website is a calendar for the lab. Because that's where we always have the problems, right?
Mhm.
Because people will show up to bring their water samples in and we're closed and they're not too happy. So we want to do everything that we can to prevent that. And yeah, we'll definitely get the word out and make sure people are aware.
Any further question or discussion? I think we can have a voice vote on this. We're not spending money. All in favor, say aye.
Aye.
Any opposed? Motion passed. Wastewater surveillance program update.
Yes, and I emailed, and it's in your packet here, but I emailed kind of just a synopsis, a summary of the activities that we do at the Northern Michigan Regional Lab in Gaylord regarding wastewater surveillance. And basically this project started as a pilot project back in 2020. The fall of 2020, where this network was being established. Is actually a nationwide network, and the network in Michigan was being established to analyze wastewater for the SARS-CoV-2 virus, or the virus that causes COVID.
Hey, Dan.
Yeah.
While you're talking, can we pull that up on the screen? Because I got a couple questions on if we could have IT pull it up.
Okay. Is that what it's this in the packet?
The results for our 20 sites.
Oh, the dashboard?
Yes.
Okay. So they'll work on that. Yeah, so basically, you know, this began as a pilot project, and then it turned into a larger project. So here in Northern Michigan, for the Northern Michigan Regional Lab, there's a site also in Traverse City. The Traverse City wastewater treatment plant in the city does that. But for us here in Northern Michigan, as you can see on this map of Michigan, there's sites, you know, scattered throughout the state. We collect samples from 18 different sites. Some of them are wastewater treatment plants. Some of them are congregate care settings, and some of them are schools, which I kind of listed out through there. And then I put some links to we have a HD&W COVID wastewater dashboard, and then there's also a statewide dashboard that reports those results. But ours is more up to date, or as far as with time, it's updated weekly. So really, you know, what this does, just so you know, as if someone is infected with COVID, that the SARS-CoV-2 virus is shed in their feces, and it can be basically detected about a week ahead of time from the time that someone becomes infected. So I kind of laid out a couple different scenarios in here about for the wastewater treatment plants and a community approach. You know, we're looking at those numbers, and if we see a spike in virus numbers, then we could put out an alert to the public and say, you know, basically we're seeing this spike. We are seeing this activity, and it's from that we can imply that we're going to have increased cases in COVID. So if, take the precautions that you deem are necessary. You know, if you are, if you're feeling sick, then try to stay home. If you are, have underlying conditions, maybe, consider where you're going out in the community, because this is, popping up. So same thing with schools, you know, and that's on a little bit smaller scale, right? So we can alert the school and say, hey, we're seeing this activity. This happened this fall, for instance, in Mansalona, and they reached out and said, well, you know, thanks for letting us know. We don't have enough test kits to send home with kids. Can you get us more test kits? So we did that. And another example, and as you know, as we get into the smaller settings, like the smaller congregate care settings, which I think have the most direct impact, like nursing homes and whatnot, you can actually take more direct actions, because if we're seeing that there, you know, you have old folks in a nursing home, people that are vulnerable to infection or bad outcomes. We actually had in one of those cases at one of the nursing homes, we saw a spike, talked to their nursing director. We were able to work out to where they could do a lot of swab all the residents. We could determine, and then we ran those tests in our lab, and we could determine, you know, those that were infected, and they could get them separated from the rest of the group. So they didn't infect everybody else and prevent an outbreak. So that's kind of the gist of why this is being done. We are actually, the network is bringing on a couple of other viruses that we're going to be looking at, and that's RSV and norovirus. Same reasoning behind that is you have like an early detection to be able to prevent bad outcomes, so to speak. And same thing on the larger community level, you would just give a general, warning to the public. And as you get smaller and smaller down to like those congregate settings, and we just primarily have nursing homes, but it could be, I know others, well, we also have college dorms at NCMC that we look at the wastewater from there. But other sites in Michigan, they look at jails. You know, I know there's some sites that look at jails, and they've done those interventions at jails too when they've seen those increases. So that is the general idea behind this. This is something that was brand new that, you know, came out of the COVID pandemic and is more or less a epidemiological tool to help prevent disease. And then I think Chris is pulling up the dashboard. So you had a question about one of the sites? Or
Yeah.
some of the sites?
Yeah. Can you go to the Blair wastewater treatment?
Bel Air?
Yeah.
Okay. And that one, I should say, that's still up there. Bel Air and Mansalona are still up there, but we don't do those anymore because they had staffing issues. They could not, because we, basically we have a staff member that shows up, a courier that picks up the wastewater samples. So we did them for a short time, but then, basically we'd have our person show up and there'd be nobody there, right, to give us a sample. So it became a problem. They had severe staff shortages. So we just decided that, we can't do that anymore. So they're actually not one of the sites anymore, but they were.
I saw on all the sites that I went to on there that they began in September. Is that?
Not all the sites. The school.
I mean, that's, if you pull up a graph. This isn't the same website that you sent us, but I think it's similar.
It's just a different part of that dashboard.
Yeah, that's the one I was on.
Yep.
So, yeah, right there. So if you go down to Charlevoix Elementary School. Oh, it's not, is that on? Yeah.
Yep.
So I'm just curious, there's a number of these that you have no spike whatsoever. So
that's true.
Does that mean that there is 0 people that are showing this at that time, or what?
Yeah. And then, some of it depends on if they're, obviously if they're using the facilities, the bathroom at the school, like when they're there, because we're not going to see, if they're not using it, you're not going to see anything. Right. So you have that factor. The September that is schools and NCMC. We don't test them throughout the summer because there's no one there.
Okay, so go to Meadowbrook if you would. See, this one starts in September too.
Okay, so you see that bar on the bottom of the, where it says gene copies, you can expand that.
Oh,
Yeah. That goes back in time.
okay.
Yeah.
And when did this begin?
Meadowbrook. We brought them online, I think about a year ago. They were a latecomer because we had Boulder Park, here in Charlevoix was in the project. And then we ended up taking them out because we were getting inconsistent results, and it had to do with all the cleaners they were using. And we were getting interference with the technology that we're using. It just was not working. So we decided to drop them, and we added Meadowbrook at that point.
Yeah, Mr. Chairman, I guess where I'm going with this is, we're spending over $1 million on this. Most of it's state money, and I realize that, but this is a phenomenal waste of taxpayer money. It's inconsistent information. It's the people that could use it, get it delayed. So I would like to make a motion to end the wastewater surveillance program effective immediately.
I'll support.
We have motion and support. Is there any further discussion? Ms. LaVanway?
I have a question. I had a person that asked me this and I said, I don't know. We know that in schools, when you do testing, that there's a lot of sports every single night with different sports teams. And if it was a positive and you found there was a positive, we would assume that it would be people in that community. But if you have regional sports, more than one team at that school that day, what is it the school's responsibility to inform the people who've been there the day? Is it the health department's responsibility to notify that is? I don't know. That's my question.
Yeah, sure. Good question. It is the health department's responsibility. I mean, we are collecting the information. We reach out to the stakeholders when there is, when we do see a spike. I would say from the sports activities, those are typically towards the end of the week. Typically we're taking samples usually for schools Tuesdays and Thursdays, twice a week. And those are, typically in the later morning. So theoretically, like any of those things that happened in the school at night or whatever, they would be, through the system. We would not be picking up indicators, I guess, from that event, if that makes sense. Because as wastewater flows, I mean, especially large events, that's come and gone. It doesn't take long for that. The idea is that we're picking up the wastewater samples from when the school is occupied by the staff and the children and the people at the school.
So if it's at night, it wouldn't be affected when you do testing?
No, it would not.
Okay, thank you.
Yeah. And I'll just say, basically we get about, I think, just over 700,000, not over 1 million, just to clarify, in this program. We've had some carryover funds, which just continue to carry over because we have not spent it all. And that'll go back, at the end of this project. And this project is slated to end the middle of the summer. So we don't have a terribly long period to go, but, and we have, agreed to and signed, agreements and grants with MDHHS and Eagle, to do this program.
That's my other question. So how does the health department work with Eagle on that situation?
What situation?
Where's the connection when I know Eagle oversees wastewater treatment places, but is there a connection between Eagle and the health department when it comes to finding the disease?
It's more of so Eagle does play a part in it. They have more of the technical expertise. But MDHHS is the one that is administering the program.
Okay.
So the agreements that you've signed, Dan, how would that be affected if this motion were to pass?
That's a good question. I don't know. It may be, I don't know if Shannon, if you have anything to add to that.
So the signed agreements, we will have to go back to MDHHS and Eagle and talk to them. We would no longer be receiving the funding. Anything that we've spent probably to date, they could reimburse us for, but after that, we would have to send the money back to them. Again, as Dan mentioned, this is ending in June, so we fully expected the money to stop in June anyway.
Chairman Hankins,
Sure.
I'd like to read a couple of the paragraphs out of this. But then, of course, if it stops in June, there's always the potential to restart. But anyway, monitoring wastewater for COVID-2 can provide an early indicator for the presence of disease in our community and be used to track trends over time. This can especially, it can be especially important as clinical testing rates decrease. COVID-2 virus can be detected in wastewater before infections lead to increases in clinical cases. I'll go to the next paragraph, a little longer paragraph. The monitoring of these sites is population based on this. This happened this fall. You mentioned this, Dan. This happened this fall at Mansfield High School, which prompted the school to ask for additional home test kits, which were provided through the department. Lastly, public health actions at smaller sites like long-term care facilities could be more hands-on. In one instance, the long-term care facility had a spike in virus load, which prompted the medical staff to ask for assistance with PCR testing. Northern Michigan Regional Lab was able to coordinate with long-term care facility staff and get all the residents tested. Those that were positive were isolated, which prevented a much larger outbreak. So the problem comes, how do we know that these outbreaks are going to exist? It didn't exist. We're stating that it's going to prevent these outbreaks, and yet we don't know that it's become, any more than a cold anymore. Maybe to some people, but then the flu can kill elderly that, so my question is, how in the world can we determine that an outbreak will take place because we found this in a school or a nursing home? And what are the results of the outbreak? I think we're presuming here. What answers do you have for that, Dan?
Well, I mean, it's true that a lot of the work that we do is prevention. So it's, it's hard to measure. I can't measure something that doesn't happen, but I mean, that's the whole point. It's, that's standard, classic public health practices to do things. If you have a good idea that something could happen or may happen, is to take steps to prevent that. And that is essentially what this wastewater surveillance program does. Is it's a tool, right? It's an epidemiological tool that says, okay, we see a spike. We know that SARS, that virus is in that wastewater, presumably coming from, individuals in that facility, and we can take steps to try to prevent a larger outbreak to where people could, become really sick, have really bad outcomes, or possibly die. And that's essentially what it is. I can't say for sure that, that there's so many different factors involved, but it's more or less, a tool to try to prevent a larger outbreak if we can.
Mr. Chair, I have an additional question.
Mr. Turnbull, go ahead.
Dan, are you guys testing for other, other viruses, or is it just the SARS that leads to the COVID?
We're looking at, actually MDHHS as part of this project wants us to start testing for, norovirus and RSV. Which would be, again, another tool, where we can prevent a larger outbreak, and is probably more relevant now, that COVID is kind of, waning and taking a back seat, where we have, flu and RSV, or norovirus and RSV becomes a much, bigger risk. So, essentially, it's just a matter of the type of, assays that you use with the equipment, and all the other processes are still the same. It's just
Okay.
more or less, testing for those particular viruses versus the other.
Mr. Fruit, go ahead.
Thank you.
Mr. Chamberlain.
So I sit on the Grandview board. And I
Yes.
reached out to Joe, and he says he only gets like monthly reports. And he just feels he liked it, but the problem is it's too late. When stuff comes in, they're already facing it. They're already dealing with the COVID stuff. And, if they're reporting monthly, it just doesn't make sense. It'd be too late. You'd already be going through other viruses. So that was my big concern, was how long it takes to report back. Because even in a
Well-
week, it's a lot of time.
Yeah, and I will just say that we don't always, because, these facilities are busy, we're not reaching out to them all the time to give them the results. That's why we created that dashboard, so they could go and look at it. But we monitor it every day, during the week. And when we see a spike, that's when we would reach out. So we gave them the dashboard so they could look at it at their convenience, reaching out when we see a spike to try to alert or, inform them as far as what they could do and offer any assistance and help that we can, because that's what we do as a health department.
Mr. Chair,
Go ahead.
I have one other thing. One point I wanted, as you all are discussing this, to consider. This program was included in the budget that we approved back in September. So if we take this out, we're going to have to relook at that budget. But just as you're all debating this, it has been approved in the budget.
Mr. Chairman.
Mr. Rubin, go ahead.
So I think the whole crux of this is what Dan already mentioned. Prevention. And COVID and norovirus are two very different things. If COVID was preventable, then all the schools and everywhere that had mask mandates, nobody should have ever gotten it. And if it was preventable, then no one who got the shot should have ever gotten COVID. The whole point of COVID is it is not preventable. If it was, we would have prevented it. And no one would have gotten sick from it and no one would have died. But it's not preventable. Not only is it not preventable, it's not curable. And not only is it not curable, for most of these sites that are schools, it's not fatal. It doesn't bother kids. We've known that for years now. And to just continue this nonsense. As far as norovirus, bring that back to us in 6 months when they get that up and running. That's a whole different conversation. And I would be totally open to hearing the pros and the cons of that, because norovirus is very contagious and we know some of the things to do to prevent it. So if we knew, the other thing about this is we're testing wastewater. Now, I have the unfortunate experience of taking fecal samples from my cattle. It's not pleasant, but I can tell you this, by the time it's in the manure, it's too late. If that cow is in the pen with the others, what is in the manure has something to do with what her body was doing 48 hours ago. She's already contagious. It's too late. Does it give you information? Sure. Does this give us the information? Absolutely. But at what cost? This is taxpayer money, and we can say that it comes from Eagle and it comes from MDHHS, and that's all true. But we have a responsibility not to just keep doing something because we've done it. And COVID, this does not contribute in any way to prevent, cure, or anything to do with COVID. So and as far as the thing about, well, we approved an agreement with MDHHS, that agreement was never brought before this board to approve. So we never approved it. The health department people may have, but this body never voted on that.
Go ahead, Shane.
This body voted on the budget and it was in the budget. You didn't approve the actual contract. We sign contracts all the time, but it was approved in the budget. I can guarantee you that.
And we can make a budget amendment at any time for any reason.
It's true.
Can I say something?
Go ahead.
I would
Mr.
just
Surratt.
say, in a lot of the things that you're bringing up as far as, yeah, I mean, COVID is thankfully is waning, right? But I will say that by doing this project, you don't have the amount of testing that we had. We didn't, we're not doing the clinical testing. We're not doing all those things. So by monitoring or surveillance, which is part of, what we do when we look at diseases in public health, is just routine surveillance. I have equipment and staff in place doing this work. It's probably, it only goes through the middle of the summer. It could possibly turn into something else, but for looking at norovirus and RSV and maybe flu, I don't know. That's pure speculation at this point, but I would just say we're on the downward swing of this being phased out. Okay. So, I mean, to abruptly end it, it doesn't make sense to me. I still think it's valuable. I need to look at it from, the standpoint of what our lab does. We have individuals that are employed there that can actually cover for other aspects of the lab when people are off for whatever reason, whether it's medical or vacation or things like that. It strengthens our lab by having this program in there. I understand your reasoning behind COVID, but this work has opened up a new door, I guess, from the standpoint of just public health surveillance. And I think it's valuable.
So how many sites are we testing on a weekly basis now?
18.
So we're well in excess of $50,000 per site to test per year, which comes to over $140 per site per day. And it's responsible to continue this. Right.
Chair.
Mr. Aaron's.
Again, this is the second time I've picked this up, and I'm going to quote right from the mission of the health department: to serve our entire community and to achieve health equity by promoting well-being, preventing disease, and protecting the environment, and on. But preventing disease is the second thing. And if this helps prevent disease, it's in the mission of the health department, period. Full stop. Are we not going to fulfill the mission of the health department?
That is the whole point of this conversation. This does not prevent disease. You hit it on the nail head. That's the whole point I brought this up. It is not within our mission.
Well, if you're talking about elementary schools and such, I worked in one for 10 years. And I will tell you, the kids came in sick, and then all the staff got sick. I was ill every winter because of kids coming into school ill. So if this helps figure out if the kids are getting ill in the school to take precautions. I mean, when you walk out the door in the morning, you don't just not put on a coat unless it's 80 degrees, you know, it's gonna be 80 degrees for a week. You put on a coat and you prepare for the environment. So this is preparation for the environment of this disease running through our society. It's just common sense stuff. If you can prevent something, why not? I mean, you're acting like someone's taking this money out of your own pocket. I don't understand that viewpoint at all, because they're not.
I pay thousands of dollars to the state of Michigan in taxes every day, and my constituents pay millions every year. So
This is not going to save them one dime.
it absolutely could redirect this money to go to a cause that could save their life. When you look at the lack of police support and public safety that we have in this state, we have a responsibility to spend money in the wisest and most effective ways possible. And if we save money in one place, it can be used somewhere else with far better results.
Hey, Chair, do we have any lack of police resources in our state?
Absolutely. And I'm sitting here in a police uniform. I'm telling you, absolutely, we have lack of public safety funds.
Funds or people that want to take the job?
Both.
Because mostly what I've seen over the years is people not wanting to do it.
Well, all right, let's stay on task for a minute here, Ms. LeVan.
I'd like to say something. I used to be an owner of a septic company. And it's amazing what you can see out of septic pumping and what's in wastewater treatment centers. And if you've never seen one and you don't know what they do, it's very interesting. This is a grant for that capability, but there's so much more that's being tested that goes through Eagle, that goes through so many things, that this is just one little aspect of the situation, just one. And the people that work in wastewater treatment are very qualified people. They know what they're doing. And it sounds like the right partners are working together to make prevention for people. It's not something we talk about every day. I mean, who wants to talk about feces? You know, but there's so much knowledgeable information in there. And I know, Jairus, you talked about cows, but cows will chew their cud and regurgitate and do it all over again. And it takes a lot longer than a human. So that's totally a different situation. But I think that there's a lot of good information. And I think this grant is really a good informational grant that we may learn something, and it may not just be this that they're looking for, but there might be a lot of other things that might come out of it in the future, that somebody does research and finds more about things that we were not aware of. So I just don't understand why we wouldn't want to finish doing this.
Chairman Hankins,
Mr. Mason.
I've heard the word if, supposed. This is a lot of supposition. We're presuming here that something is a fact that very likely may not be. The word if was used several times. And this isn't the way to run $1 million worth of grant money.
Mr. Thrill.
Yeah, I just say, I mean, this funding is through that package of COVID funding, right? That we talked about at the budget meeting and whatnot. It's not coming from any other source. It was specifically earmarked for that. This project is statewide project that's part of a national project, and it is slated to, end this summer. So, I mean, it's not something that is continuing. I think with a lot of the COVID funding that we talked about, it's all ending, right? And I just wanted to be clear on that it's not something that's going to go, if we don't do it, it's not like that money is going to go into some other state program, because that's not the case. And again, I think it, you know, it's valuable that we continue to do it. It meets our, you know, our mission, as Commissioner Aaron's pointed out, and our broad mandate from the Public Health Code to prevent disease. And it is completely new technology that, you know, that started in other parts of the world and we started doing here in the United States. You know, we've learned a lot. And as, you know, Commissioner Levanway said, I mean, it's not like it's not valuable because COVID is waning or any of those things. I mean, it is a tool, it's a public health tool, and we're learning from it. I would just respectfully ask that we're just allowed to continue the program and just let it end on its own. That's all.
Mr. Mapes, did you want to speak?
Yeah, I just, a question. Ever since this conversation started, I was in favor of just letting it end. And you've made the statement when you were explaining everything that's gone into this grant, you know, all the research and the equipment and the staff that's been added. What's going to happen to those people when this grant money goes away?
That's a good question.
So,
I mean, as part of that though, just further answer that is, you know, they know that the grant was ending in July.
So basically, as we go forward, you know, I gotta say shame on us as a board that we didn't catch it when we approved the budget. You know, obviously it was before us. We didn't ask the right questions. If it's in the, you know, when we see stuff, grant funding, we want to know what we should probably be asking what it's for. You know, what specifics will it provide? We should have been having this question, I think, back then versus right now. You know, that was my thought from the very beginning. Again, is let's just let this play out, but we got to be careful with the board. We got a problem with stuff like this. We need to address it as it comes, not when it's almost over with. You know, it's made us aware, I believe, of maybe taking a deeper dive of what all this grant money is going to be used for in the beginning. Again, we're back to grants. You know, what's that money going to be used for? What's the duration? How many people are we going to have to hire to fulfill the obligation of receiving the grant money? What's going to happen to those people after the grant runs out? Are we just going to continually renew grants to keep people employed? So, my position hasn't changed. I would like to let this run out.
Well,
on its own.
Oh, sorry, go ahead.
So yeah, my position hasn't changed. I'd like to let this grant run out on its own and not do anything about it. I'd be opposed to canceling it right now immediately.
I would just say one thing too, like, you know, we were talking about grants and, you know, we put a policy in place that we worked on for a really long time. And, you know, this is one of them, you know, had this come up now, like brand new, it's something that would be going through the program evaluation committee and being looked at in detail and all those sorts of things. This started in the fall of 2020, even before I was working for this organization, essentially.
So I've been making some notes here as this conversation is taking place, and you know how in some workplaces they have a cuss jar where if you use a bad word, you have to throw $1 in it. I'm putting one over there for COVID. Anytime somebody says COVID from now on, you have to put $1 in the cuss jar because I'm very tired of it, like everybody else.
How much were you putting in each time?
I've made some notes here, listening to the conversation. In talking about schools, sporting events take place throughout the week. And I think to track the people that attend those sporting events and reach out to them and say, hey, by the way, you may have been exposed. I would agree that it's too late. Number one, I would think that it's basically impossible to track everybody who has attended a sporting event. If I go to Harbor Springs to ref next week, and Harbor Springs a week later is told that they have and exposure, I doubt that you're going to know who everybody is that was in that building. I just don't think it's possible. Number two, on healthcare facilities, they should know when their patients are sick. And then they should test them. I think it's way behind to reach out to them the next month. If Grandview gets it a month at a time, if they haven't figured out somebody's sick in that month, shame on them. Now, having said all of that, I trust Dan. And when Dan says something is valuable, I don't think we have fleshed out everything here that Dan and his staff have considered in this program. And I'm going to defer to his judgment. So I waited until everybody else spoke, but is there any further discussion or conversation or questions? We have a motion by Mr. Rubing to end the wastewater treatment or the wastewater surveillance program immediately. That was seconded by Commissioner Chamberlain. Is there any further discussion? Hearing none, can we have a roll call, please?
Commissioner Aaron's,
No.
Commissioner Levanway,
No.
Commissioner Mapes,
No.
Commissioner Hankins,
No.
Commissioner Turnbull,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Rubing,
Yes.
Commissioner Mason,
Yes.
tied vote.
That's 4-4, ladies and gentlemen. That motion has failed. That brings us to public comment. Again, ladies and gentlemen, if you would like to address the Board of Health, you can step to the podium, state your name and where you reside. You will have 3 minutes to address the board. Mr. Swartout.
Mr. President, the small progress we have made after 4 or 5 weeks close. Attendance and continual meetings with each other by different families on almost every question, several of the last producing as many no's as ayes. Is we think that no one knows proof of the full perfection of the human understanding. We indeed seem to feel our own want of spiritual wisdom, since we have been going about in truth.
We have gone back to ancient history for models of government and examined the different forms of those republics which, having been formed with the seeds of their own dissolution, now no longer exist. And we have viewed modern states all around Europe, but find none of their constitutions suitable to our circumstances. In this situation of this assembly, groping as it were in the dark to find political truth, and scarce able to distinguish it when presented to us, how has it happened, sir, that we have not hitherto once thought of humbly applying to the Father of lights to illuminate our understandings? In the beginning of the contest with Great Britain, when we were sensible of danger, we had daily prayer in this room for the divine protection. Our prayers, sir, were heard, and they were graciously answered. All of us who were engaged in the struggle must have observed frequent instances of a superintending providence in our favor. To that kind providence, we owe this happy opportunity of consulting in peace on the means of establishing our future national felicity. And have we now forgotten that powerful friend? Or do we imagine that we no longer need his assistance? I have lived, sir, a long time, and the longer I live, the more convincing proofs I see of this truth, that God governs in the affairs of men. And if a sparrow cannot fall to the ground without his notice, is it probable that an empire can rise without his aid? We have been assured, sir, in the sacred writings that except the Lord build the house, they labor in vain that build it. I firmly believe this, and I also believe that without his concurring aid, we shall succeed in this political building no better than the builders of Babel. We shall be divided by our little partial local interests. our projects will be confounded, and
30
we
seconds.
ourselves shall become a reproach and a byword down to future ages. And what is worse, mankind may hereinafter, from this unfortunate instance, despair of establishing government by human wisdom, and leave it to chance, war, and conquest. I therefore beg to move that henceforth prayers imploring the assistance of heaven and its blessings on our deliberations be held in this assembly every morning before we proceed to business, and that one or more of the clergy of this city be requested to officiate at that service.
That's 3 minutes, sir.
The motion was adopted and the rest is history.
Thank you. Would anyone else like to address the board? Yes, sir.
Scott Coger, Antrim County. Let's talk about the microphones. 20, 30, 40 times at least, Mr. Chairman has brought it up, usually at the beginning of meetings. It's not just so we can hear you in the room. It's also so there's a record and people watching online can hear you. Numerous times I've watched online and I couldn't hear because the microphones are off. We're looking around. We're sitting back. Manners and etiquette, please. Let's have a record. Let's make sure everyone can hear, especially if they can't attend a meeting. Etiquette. Manners. Yeah, if you're gonna call yourself a Christian, please act like it. Make sure your actions meet your words. Let's be open-minded. Let's look at both sides. This testing of the wastewater, I love science. I'm not gonna say I'm for or against it, but I'm looking at both sides. There's some misinformation today spoken, and open your minds. Your smartphones, use them for good. Don't poison yourself. Watch out for some of these groups that cause a lot of ruckus with the health department. Otsego County Liberty Rising, Emmett for Responsible Government, Grand New Party. There's just a few I know of. Watch out for the poison. It's good to question things, but be part of the solution, not part of the problem. That's all I can think of. Should have wrote down notes. Let's have some manners, some maturity. Thank you.
Would anyone else like to address the Board of Health?
Hope I get close enough to this. Joe Murphy, Emmett County. Our current congressman is supporting the budget. Let me start again. Currently in Washington, they're looking at getting the budget under control, getting it passed. Our current congressman has supported the idea that we should cut food stamps by 40%, Meals on Wheels by 30%, and Medicaid funding. I would encourage people who think the funding should not be cut to get in touch with the congressman and tell him, don't vote for to cut those programs. Thank you.
Anna Young, Charlevoix County. First, I'd like to thank everybody here for taking the time to be on the board and for our health department that I think does an outstanding job in our community. I have a question, and it's regarding the sewage testing. I'm not sure if this is part of a national research project, and if such, I'm a strong supporter of science. And scientific method says that I present a hypothesis to test, and then I see if the data I collect supports the hypothesis. And sometimes the data I collect supports it, and sometimes it doesn't. I'm very thankful that Thomas Edison tried multiple filaments before he came up with the one that worked. Otherwise, we'd still be in the dark. And I'm really glad that he had the perseverance and didn't know for sure whether or not he could invent a light bulb. It sounds like this sewage testing, although COVID may not be the final thing that we test, it may be part of our scientific knowledge that allows us to prevent not only norovirus, but perhaps hepatitis C, perhaps other things that we can't even imagine. I didn't know that cell phones would ever exist, except in science fiction, and now they're a great tool. So let's not give up on the scientific method and ongoing research.
Would anyone else like to address the board? Going once? Going twice? Dr. Young, you need to leave $1 on the table because you said the C word. I'm kidding. I'm kidding. I'm kidding. All right. That moves us to commissioner comments, 3-minute limit. Mr. Rubin. Ms. Levanway.
I have nothing.
Mr. Mapes.
I'm fine.
Mr. Aaron's.
I have a thought.
Mr. Chamberlain.
One.
Oh, I'm sorry.
I have
I'm
a
sorry.
thought. Yeah.
Go ahead.
As I was listening to the words of my fellow Masonic brother, Benjamin Franklin, I was reminded of an admonition that we are given as far as regarding our lodge meetings. And that is we don't speak of religion or politics within the lodge, because those are things that divide people rather than bring them together. And our whole idea is to bring men together that wouldn't necessarily have met, walking down the street. It's to bring people together. So eliminating divisive parts of a meeting is probably wisdom, because we don't need to bring in division into this room. And again, this building is not a church. There's places to go and do that. They're called churches. And if you have a personal belief that's so strong, you take a moment and think about things for yourself. But to put it on other people and force them to it in a public meeting, you can say, well, people don't want to necessarily walk out the door. They want to be respectful, but they also want to be respected themselves. Heard a lot of talk about respect for prayer and such, but how about the people? What about the other people that just come here for information and not a preaching to? And I'm the nephew of a pastor that was a 40-year pastor. I was brought up very religiously, actually. But I also respect people that don't want to necessarily hear my thoughts on that or any prayer for me. So it's about respecting everybody. And I heard the word etiquette brought up earlier. Maybe we should listen to that word etiquette. Taking a quiet moment of silence for things is fine. But to get up here and preach, whether you're sitting in one of these chairs or at the podium, this guy says, no, it's not the time nor the place. Period. Full stop.
Mr. Chamberlain.
I just want to thank the health department and the employees and everything you do in my district of East Jordan. We've had to use you guys a few times for my daughter with her dog bite. On the mental side, she went from sleeping in a bed to had to sleep with us for a while, and with the help with the school counselor through the health department, she now is back in her bed. She'll have to sleep, go to bed, but we have to move her. So just amazing. I never expected that a simple dog bite. There's a lot more to it on the mental side than I ever thought. So thank you for the work you guys are doing.
Thank you, Mr. Mason.
I think when we look at these groups that exist within different counties and both sides of the issues, there have been a few that have been more recognized within Otsego County, Emmett, et cetera. Thank goodness we have the freedom to speak. I don't agree with everything that comes out of Liberty Rising, but they use a fair amount of common sense in bringing forth issues and bringing light to issues. And every one of us has the right to choose. Where do we stand on these issues? Thank goodness we still have that right left in this country to be able to form these groups and speak to the issues and inform the public. Thank you.
Thank you, sir. Mr. Turnbull.
Yes, three hopefully quick things, for everybody's behalf. Start my 3 minutes.
I did.
But as far as prayer, I'm very supportive of prayer. I mean, we do it before just about every organization from Congress all the way down to our Board of Commissioner meetings. Prayer, I mean, it helps, keep, level heads and clear our minds, clear our thoughts, and bring us together. But it also does something else very important with Veterans Day coming up on Friday. I want to say thank you to all of our veterans that have served. All of our guys, why do they, why do we serve? Why do we do what we do? I mean, I know I served to preserve our union, to preserve freedom, justice, promote the American way of life. And that's, I mean, the freedom is the big thing. I mean, we're not turning anybody away. I mean, the pastor that got up and spoke, and did the prayer to, sorry, I don't remember what, but you're allowed to, pray the, Native American prayer, the, young lady who came and did the, I believe, the Muslim prayer a few months ago and the Sikh prayer last month. I mean, we welcome it. I mean, that's what we have public comments for. And that's what, I mean, our country is founded on, is the freedom. Don't get into separation of church and state. I'll do my best to school you on it. With why Thomas Jefferson wrote that in a random letter. But, so, prayer, I want to encourage us that we continue to do it. And I want to encourage us to, I mean, as Veterans Day comes up, thank our veterans for giving us the freedoms for things like this, the health department to exist, our counties, our country, to be free in order to worship whichever God we desire to worship in our own way. It's fantastic. And I want to encourage people to get out there and, on Veterans Day and, shake the hand of a veteran, tell them thank you for asking, and even ask them, why did you serve? Why did you do it? I mean, you'll be surprised, and their stories are fantastic and amazing. The second thing, the third thing, just as a soldier, I understand that I stand with the nation of Israel and their fight against terrorism. I see as something a little different than what a lot of the news agencies are beating them up for, that they're actually doing this to help defend the Arab Israelis, many of which I've served with in Gaza and the West Bank.
30 seconds.
So thank you. So I want to stand with that, stand with freedom, justice, and again, promoting the American way of life. So thank you.
Thank you. I have no further comment right now. I would take a motion to adjourn.
Second.
Were you making that motion, Mr. Mapes?
You did. That was-
Oh, no, I didn't, but
I'll
I
make a-
can.
I'll
I'll
make
make a motion to adjourn. He seconds it. All in favor, say aye.
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 Any opposed? Thank you, ladies and gentlemen. No, no, I have not.